The topic of the tutorial is lacrimal apparatus, and I, Dr. Alpana Kesar, will be covering this topic under the following subheads: the components of the lacrimal apparatus, the production, flow, and drainage of tears. The lacrimal apparatus is involved in the production, movement, and drainage of tears or the lacrimal fluid from the surface of the eyeball. The components of the lacrimal apparatus are the lacrimal gland and its ducts, the conjunctival sac, lacrimal canaliculi, lacrimal sac, and the nasolacrimal duct. Lacrimal gland is present in the anterior part of the supralateral region of the orbit. The levator palpebrae superioris divides the lacrimal gland into two parts: the larger orbital part and the smaller palpebral part. The orbital part is located in a depression called the lacrimal fossa in the frontal bone. It is present in the roof of the orbit. The smaller palpebral part, as the name itself suggests, is located in the eyelid. It is present inferior to levator palpebrae superioris. Lacrimal gland has numerous ducts. These ducts pour their secretion in the superior fornix of the conjunctival sac. The fluid which is secreted by the lacrimal gland is continuously moved across the surface of the eyeball as the eyes blink. The lacrimal fluid produced by the lacrimal gland will travel across the conjunctival sac medially and gets accumulated in the lacrimal lake, which is present near the medial angle of the eye. This lacrimal fluid will then pass through the lacrimal puncta into the lacrimal canaliculi. Lacrimal puncta are small openings present on upper and lower eyelids. These are the openings of lacrimal canaliculi, and the lacrimal fluid from the lacrimal lake will pass through the lacrimal puncta into the lacrimal canaliculi. The lacrimal fluid that passes through the lacrimal canaliculi will reach the lacrimal sac. The lacrimal sac is located between the anterior and the posterior lacrimal crests. When the orbicularis oculi muscle relaxes, the lacrimal sac will expand. When it expands, it will draw the lacrimal fluid from the conjunctival sac, which will pass through the lacrimal canaliculi into the lacrimal sac. When the orbicularis oculi muscle contracts, as in case of blinking, it will compress the lacrimal sac. This will force the lacrimal fluid out of it into the nasolacrimal duct. From the lacrimal sac, the lacrimal fluid will travel via the nasolacrimal duct. This is the nasolacrimal duct, which opens in the inferior meatus of the nasal cavity. That is why sometimes when we are crying a lot, there is a lot of fluid running out of the nose, which is actually the tears draining from the conjunctival sac into the nasal cavity. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Innervation of lacrimal gland involves three components, namely secretomotor, sensory, and sympathetic. The secretomotor or parasympathetic innervation of the lacrimal gland follows the following pathway. The preganglionic fibers begin in the lacrimatory nucleus of pons. These fibers then pass into the nervous intermediaries of the facial nerve and then into the facial nerve. The preganglionic fibers then pass into the greater petrosal branch of facial nerve and relay into the pterygopalatine ganglion. The preganglionic fibers will synapse with the neurons present in the pterygopalatine ganglion. The postganglionic fibers arising will pass into the maxillary nerve. From there, it will pass into its zygomatic branch and then into the zygomaticotemporal nerve. The postganglionic fibers then pass into the lacrimal nerve to reach the lacrimal gland and control the secretions of the lacrimal gland. Sensory nerve supply of the lacrimal gland is through the lacrimal nerve, which is a branch of ophthalmic nerve. Sympathetic innervation is from the superior cervical ganglion. The postganglionic fibers travel as a plexus around in the internal carotid artery. The fibers then pass into the deep petrosal nerve, which joins with the great petrosal nerve to form the nerve of the pterygoid canal. The postganglionic fibers reach the pterygopalatine ganglion and traverses through it without relaying into it. The onward journey of the sympathetic fibers is same as that of the parasympathetic fibers to reach the lacrimal gland. In the lacrimal gland, the sympathetic fibers are vasomotor and control the blood flow to the lacrimal gland. Blockage of the nasolacrimal duct will block the flow of tears from the conjunctival sac into the inferior meatus of the nasal cavity. This will result in tears flowing directly from the eyes onto the cheek. The prolapse of lacrimal gland involves downward movement of the lacrimal gland, where then the lacrimal gland can be seen protruding through the eyelids. When there are malignant tumors of the lacrimal gland, there may be a need to excise them. Questions from the topic lacrimal gland that may be asked in the exams are: enumerate the components of the lacrimal apparatus, briefly describe the lacrimal gland, pathway of flow of lacrimal fluid or tears, secretomotor pathway of the lacrimal gland.